Hello and welcome to the Home Health Training Part 1. I'm Teresa Mata and I will be presenting this training for Section K swallowing nutritional status. I've been a registered nurse for 30 years and have experience in direct patient care, education, nursing administration, quality improvement and measurement, as well as the development of post-acute care patient resident assessment instruments. My experience includes inpatient care and long-term care facilities and assisted living, as well as a nurse consultant at the Centers for Medicare and Medicaid Services, assisting with the implementation of the IMPACT Act. Currently, I am a nurse researcher and health research and evaluation associate at Apt Associates in Cambridge, Massachusetts. At the conclusion of this session, you should be able to describe the new and revised data elements in Section K, discuss the intent, coding instructions, and definitions for the Section K items, and explain the changes to coding instructions for other Section K items. These are the new data elements that are found in Section K. The first is a new standardized post-acute care or PAC assessment item added to the Outcome Assessment and Information Set version E or OASIS E. K0520, nutritional approaches. The other items are M1060, height and weight, which was retained from the OASIS D1, but has been incorporated into Section K to align with the other PAC settings. For additional information, please refer to the OASIS E manual available on CMS's OASIS User Manuals webpage. Now let's take a closer look at what is included in this section, starting with K0520 nutritional approaches. The intent of K0520 is that there are many conditions that can impact a patient's ability to maintain adequate nutrition and hydration. The items in this section are intended to assess this. And here is the rationale for this item. When patients must rely on mechanically altered food or other methods for their nutrition, such as feeding tubes, this can diminish their sense of dignity and self-worth, and certainly the pleasure and enjoyment one gets from eating real foods. However, based on the patient's clinical condition, they may benefit from various nutritional approaches that are included in this section. Here are just a few definitions to get us started. While I will not read the entire definition, since most of you would be quite familiar with these, I will just say that parenteral or IV feeding is nutrition that avoids the GI tract, while a feeding tube delivers nutrition directly into the GI system. And here are a few more definitions to differentiate a therapeutic diet from a mechanically altered diet. A therapeutic diet would be a diet prescribed as part of a treatment for a particular disease or condition. For example, a low sodium diet. And a mechanically altered diet is one that alters the texture or consistency of the food to facilitate oral intake, like pureed foods or thickened liquids. And this is a screenshot of this data element as seen on the OASIS E. You can see that at start of care, or SOC, or resumption of care, ROC, one would be assessing whether there are any of these nutritional approaches being used. This is a check all that apply data element. So you would check all that apply for parenteral or IV feeding, feeding tube, mechanically altered diet, therapeutic diet, or you would check Z, none of the above. K0520 looks a little bit different on discharge from agency. While you're assessing these same data elements, you're going to check the first column labeled number 4 for all nutritional approaches that apply in the last 7 days. And you're going to check in the second column labeled number 5, all the nutritional approaches that still apply at discharge. You would check Z if none of these apply for either column. Now let's look at some of the coding guidance for this new item. To determine any of the listed nutritional approaches apply, you consult with the patient, family, or caregiver and/or review the clinical record or other available documentation to determine if any of the listed nutritional approaches apply during the time period under consideration for the SOC or ROC assessment. Here is a list of some of the data sources that can be used to complete these items. These might include the medical record, whether it be paper or electronic health record from wherever the patient received care, other available documentation or notes from pharmacy, nursing staff, or the physician or physician designee, or perhaps other clinical staff, such as the dietitian. And you might also include discussions with hospital staff. And at discharge, you would be looking back into the data sources available to reference the last 7 days. So here are the response-specific instructions related to K0520. On SOC or ROC, you are going to review the medical record or available documentation to determine if any of these apply. And then at discharge, look to see if any were applicable for the last 7 days to complete column 1, and at discharge for column 2. And here are additional coding instructions. As was stated previously, this is a check all that apply data element that has 1 column to complete at SOC and ROC, and 2 columns to complete on discharge, column 4 in the last 7 days, and column 5 at discharge. You can also check Z, none of the above, if none of the nutritional approaches apply. A dash, meaning no information, is a valid response for this item. However, CMS expects dash use to be a rare occurrence. So let's just walk through a general coding tip for K0520. If a patient is going to receive one of the listed nutritional approaches as a result of the SOC or ROC assessment, the agency will check the applicable nutritional approach. Examples might include IV hydration that will be started at this visit or a specified subsequent visit, or the physician is contacted for an enteral order. Here are some coding tips for parenteral IV feeding for K0520A. Parenteral or IV fluids include those provided for nutrition or hydration. If there is supporting documentation, that is documentation defined by your facility policy and noted in the patient's record, and this indicates the need for additional fluid intake, specifically to address a nutrition or hydration need, the fluids mentioned here in the yellow box may be included. And so these examples might be IV fluids for hyperalimentation, including total parenteral nutrition, whether it's continuous or intermittent, hypodermoclysis and subcutaneous ports for hydration. And if additional fluid intake is specifically needed for nutrition and hydration, IV fluids can be coded in this item. K0520 excludes fluids provided solely to maintain access and patency. So here are some items that would not be coded in K0520A. IV medications, those would actually be coded when appropriate in 00110H, IV medications. IV fluids used to reconstitute or dilute medications for administration purposes. IV fluids that are a routine part of an operative or diagnostic procedure, or IV fluids administered to flush an IV line. You would also not include parenteral or IV fluids administered in conjunction with chemotherapy or dialysis. And here is a coding tip for K0520B, feeding tube. Feeding tubes are only used if they are used to deliver nutritive substances and or hydration during the time period under consideration. And here are some coding tips for therapeutic diet, which is K0520D. Enteral feeding formulas can only be coded as a therapeutic diet when used to manage problematic health conditions, such as diabetes. You do not code enteral feeding formulas as a mechanically altered diet. And here's one last coding tip for therapeutic diet. Food elimination diets that are related to food allergies can be coded as a therapeutic diet, such as a peanut allergy. Supplements are only coded here if they're being taken as part of a therapeutic diet to manage problematic health conditions. One example might be a supplement for protein calorie malnutrition. A nutritional supplement does not constitute a therapeutic diet, but they may be used as part of a therapeutic diet. Although supplements may be given as part of the treatment for a disease or condition. Now let's review M1060, height and weight. Please note that this is an existing data element that was updated to include the use of a dash as a valid response if the patient falls outside of these height or weight parameters. For height parameters, less than 50 inches or greater than 80 inches, and for weight parameters, less than 65 pounds or greater than 440 pounds. A dash can also be used if a patient's height or weight cannot be measured during the assessment timeframe, and no agency obtained height or weight from a documented visit conducted within the previous 30-day window is available. For additional information on this data element, please refer to the OASIS-E manual. So in summary, we've described K0520, the new data element for Section K at SOC, ROC, and discharge from agency. We also reviewed the intent, the coding instructions, and some definitions for Section K. And we learned about the updates to the coding instructions for M0160, height and weight. In closing, if you would like to submit a question regarding this presentation, please send it to pactraining@econometricainc.com by August 31st, 2022. As a reminder, a practice coding workshop will be held in September of 2022, and we do encourage you to attend. Select questions will be answered in a Q&A session during this virtual live event. Thank you for reviewing this presentation, and we look forward to your attendance at the coding workshop.